I love teaching cardiopulmonary physical therapy. That's really how I got started into teaching. I've taught at a lot of different programs, but obviously I love Campbell. It's a really fun class to teach because it is so complicated and it is very complex. It really pushes students to think outside the box and to really take into consideration a lot of the medical world, including diagnostic tests and medications. It all kind of comes together when you're talking about cardiopulmonary pathology.
Fantastic. So I hear a lot about your cardio interest. I'm sure it started in the physical therapy realm, or did it start in the cardiology realm? What does your journey look like to choosing PT and specifically your cardio role?
Yeah, I actually, as a 12-year-old girl, had a job that involved cutting EKGs. So I had a big long strip. EKGs used to come in a big long strip, and the physician would come through and write lead one, lead two, lead three. And my job as a 12-year-old girl was to cut those out and to put them onto one sheet of paper. And I always thought how interesting this was and how interesting it is. And I want to know what those things are. And so as I got into physical therapy school, I realized that those were EKGs and how much they could tell me about how the patient was going to do with exercise. Changes in those little bumps and knobs meant something. And that told me exactly what was going on inside the heart. And I just fell in love with that aspect. And then it just expanded from there. So after starting in orthopedic physical therapy and doing travel physical therapy for a while, I came to do a cardiopulmonary residency. And I have kind of stuck in that realm of physical therapy, which is a very small niche, ever since. I've been hooked, and I love to incorporate all of the different worlds into cardiopulm practice.
Well, fantastic. So, how did they draw you out of the hospital and out of travel PT and into the classroom?
It didn't take much. I have always been interested in teaching, and I actually have been teaching ever since I graduated PT school. I have been teaching anatomy and physiology, either whether it was online or at an undergraduate campus. So I've kind of consistently been teaching. After I did my residency, I started teaching cardiopulmonary physical therapy specifically, and I taught again in a lot of different programs. So when Dr. Myers talked to me, and we had a long conversation about what it would look like to leave the hospital and to come teach full time, he really had me hooked on my impact as a professor, really bringing my passion for cardiopulmonary physical therapy to students and really pulling that out of students who think they're just focused on orthopedics or sports, and really finding that student that could really benefit or really thrive in the hospital.
All right. So, would you say there's been like a big aha moment along the way, or something you just wish every single person knew about physical therapy, whether they're immersed in the profession or not?
Because I have switched a lot of areas within physical therapy, again, starting in orthopedics, doing travel physical therapy, I worked in every single setting. My aha moment has kind of happened over the course of my career. It's been about the number of times that I can change with the same one degree in physical therapy. Since I got my doctorate in physical therapy, I can go to different settings and I can practice in different ways, and I can learn new techniques, and I can mesh all of the worlds together. It is not uncommon where I'm in the hospital doing orthopedic manual therapy on a patient who has been in the hospital for a long period of time. So my aha is that with one physical therapy degree, you can really do a lot of different things and really push the boundaries of what is expected or maybe commonplace, and really start to, again, push boundaries and think about different ways to incorporate all aspects of physical therapy to treat the patient the best we can. And it really benefits the patient to use my orthopedic skills in the hospital or use my cardiopulm skills in the outpatient setting. So I love incorporating all of that. And the fact that we can do that is a big aha. And I love to share that with students.
So, what advice would you have to a student who's thinking about physical therapy as a career option?
I honestly feel like this is the best profession that there is. I feel like the ability to change within one profession, the ability to provide for others, and again, just that honor of being a part of someone's journey, getting them to the goals that they want to accomplish, taking the time to really listen, especially in the hospital, it can be very lonely for patients and they can feel like nobody is actually listening to what they're saying. And so to have that role of I get to sit down and really listen and focus on what they want to focus on, understand their goals, and really help them achieve those goals. And sometimes that's as simple as getting home. Sometimes that's getting back to walking. Sometimes that's getting back to sport. So, the best thing about this profession is that you are constantly helping others. And again, that reward of being allowed to be a part of somebody else's journey is just, it's unmatched in any other profession.